Welcome to the Heritage Area Agency on Aging's Caregiver 101 session. My name is Madeline Schiffer, and we're so happy to have you all on this call today. Our topic is dementia conversations. Just a few things before we get started. Today's presentation will be recorded and then posted to our website for those that cannot be here today or want to reference this video later. We will not be able to record the Q&A portion of the presentation. Please stay muted during the presentation. If you have a question, you can go ahead and put that in the chat box. I will do my best to work through those questions and summarize to pose them to our speaker after she goes through her information. And again, this information will not be recorded for the Q&A session. Our speaker for today is Jessica Duncan of the Alzheimer's Association. Jessica will help us to have difficult and uncomfortable conversations with our loved ones on driving, decision-making, and more. We may not be able to get to all questions or answer what you're looking for today. If this does happen, please feel free to reach out to Heritage at 319-398-5559, and a member of our team will get in touch with you. So let me introduce you to Jessica. Jessica Duncan is a Southwest Iowa native with a Bachelor's of Science in Healthcare Administration and Policy from Creighton University, certified dementia practitioner with an active advocate for families with a dementia journey like her own. She is a resource for those with dementia along with their families in her role as a program director for the Alzheimer's Association Iowa chapter. Her service to the Alzheimer's Association began as a volunteer shortly after starting her professional career in dementia in 2013 as a CNA. Some of her volunteer roles include advocacy volunteer for legislative asks, media spokesperson, CB Walk Marketing Committee, CB Walk chair, support group facilitator, and community educator. She joined the Alzheimer's Association Iowa chapter staff in November of 2022 after her clinical roles in assisted living, independent living, hospital nonprofit, also helped open a memory care, working in home health care and caregiving for her father with frontal temporal dementia at the age of 53 until his recent passing. As of November 2023, she joined the Alzheimer's Association Iowa chapter leadership team to lead their mission to deliver programs, meet volunteers interested in community education, coordinate support groups, and oversee care navigation partnerships as Iowa's program director. So we'll get started. The floor is yours, Jessica.
Well, thank you for having us. We appreciate it. And thank you for reading. I need to shorten that. So I appreciate you going through all of those things. I did put my information in the chat. So as Madeline said, there will be questions that probably come up. Just because I share my story doesn't mean that it's applicable for everybody. So if you have more questions, resources that you need, feel more comfortable with a phone call, please know that you are more than welcome to reach out to me. That's the honor of the role that I get to do. So, like Madeline said, I'm in Council Bluffs, but I serve the whole state of Iowa. So just know that even though I'm a little bit further away from you guys right now, doesn't mean that we can't help, and that we do have different walks that are in the area. We have 22 events across the state that start in April, go through October. So there are ways that you can do an action beyond today. But we are going to be talking about driving, doctor's visits, legal and financial planning, all of the exciting things that you never want to have come up at a holiday or things like that. But let's talk about it now so that hopefully we don't have to have a situation come up later on. This is said to be a 30-minute thing. There's no way you can get it done in 30 minutes. So I'm going to share some stories. I'm going to share what was helpful with my dad, what was helpful for my patients and their families. And so hopefully you guys can take something away from today. I will say as a disclaimer, I am not a nurse, a pharmacist, a social worker, a primary care doctor, a researcher, or a fortune teller. So I will not be able to answer all questions today, but I will sure try and look forward to the Q&A. It keeps me on my toes, so if you have a question, put it in the chat. I won't know all of them, but I will definitely find an answer for you. So we'll get started. All right. Some of the most difficult conversations that you can have when you do get a dementia diagnosis are going to the doctor, deciding when it is necessary to stop driving, and making legal and financial plans to cover future care needs. So, with this presentation, we kind of jump in with the assumption that everyone knows the difference between the words Alzheimer's and dementia. And I don't really agree with that. So, I'm going to step back a little bit. So, with a dementia diagnosis, dementia is the umbrella term. And so we use that kind of similarly to the word cancer. Like there's, the umbrella term, and then there's many different types. With the cancer analogy, there's breast cancer, prostate cancer, many different types. Dementia is similar in the fact that Alzheimer's is the most common type of dementia. That's why it's used so interchangeably. And about 60 to 80% of people that get a dementia diagnosis have Alzheimer's. So it's by far the largest majority. My dad was not the majority. He was diagnosed with something called frontotemporal dementia with primary progressive aphasia. It's very similar to the type of dementia that Bruce Willis and his family are experiencing. So less than 60,000 Americans have it. But our first diagnosis to even get before the word dementia was mild cognitive impairment. MCI is what we hear a lot in primary care clinics. A lot of families that come to us as we got this diagnosis, we don't really understand if it's different from dementia or is that Alzheimer's. And so mild cognitive impairment is the best first step to get a diagnosis if the family and the individual want that. It makes them eligible for home health services, hospice services. It might not meet all criteria for both of those, but those are great first steps before you might know what type of dementia it might be. A mild cognitive impairment diagnosis is helpful to get the ball rolling because a lot of times when we have these conversations with our clinical teams that are much smarter than me, sometimes when we put dementia on someone's medical record, we can't take that off. There's no cure for dementia, any of the types as of right now. There are treatments that are available to hopefully slow the progression for our Alzheimer's and our mild cognitive impairment friends. But why it's really hard to sometimes get that diagnosis is because it's really, really hard to take that off once it's on there. So, a mild cognitive impairment diagnosis is still going to be your best bet when you are having conversations on going to the doctor, stopping driving, and also with legal and financial issues. So, hopefully, that kind of clears the understanding of all those different terms in layman's terms that were helpful for me. And if we have any clinicians that are on the call that are like, nah, she needed to include amyloid plaque or tau proteins or things, just know I just want to make sure that we use terminology that works for all of our community members. I could get sciencey for you if you have questions, but put those in the chat because I might need to look up a few things too. So what am I going to do for you today? Why is it worth listening to later or staying on the full hour? So provide tips on how to break the ice and have the most common difficult conversations. Help you plan ahead and build a care team that communicates well, ideally, right? Not everybody's going to have that, but I'll share what was helpful for us and maybe what's been helpful for people that may not have the family or the village that we did. Give you the opportunity to hear from people who are dealing with similar issues. So you'll hear videos and won't just be talking at you the whole time, and then connect you with helpful resources. So if there's one thing that you take away from today, it will be not only my contact information, but also that we do have a care team that is available 24/7. I'll put that in the chat. That'll also be on the last slide. It's available 24/7, free. Does not cost anything. You'll never talk to a robot, which is great. I've called them 4 times. Still, to this day, I've never talked to a robot. And these are master level clinicians that answer the phone. So people smarter than me that can help families navigate. It is available in 240 different languages. So we really try to make sure that language is not a barrier. And it can help with questions all the way from where are those events Jessica was talking about at the very beginning that are across the nation, or what do I do with memorials memorial checks? What do I do if I did get a MCI diagnosis? What's my next step? Or as someone that got the diagnosis, what can I do to help my family? So it's really, really helpful for many different ways, but we'll go over that here in a second. And if anybody can't hear me too, if I need to turn up or anything, just put it in the chat. I have an eye on there too. I can always be louder or softer if anybody needs. But typically, when we're having some of these tougher conversations, these are things that families, loved ones, guardians, conservators may see or hear. My sister lives close by and can help, which is great if you can. Not everyone is able to do that, even if proximity is not an issue. She has always been fiercely independent, and if I step in, she will be offended. So, definitely heard that a lot in the memory care. We are just starting to notice some changes. We're not sure even a problem yet. Definitely saw this within the home health world when I was helping in the rural communities a lot of Southwest Iowa of, yeah, we're not really sure what to do next, but we know something's going on. You're busy with your own life. Don't worry about it. I can do this. It's a lot to do on one person's plate. I'm fine. Don't worry about me, as someone that's experiencing these things. There's a lot of unknown, and so sometimes pulling away is the way that people kind of figure out what they're going to do next themselves. Wait till you're my age. Things are a little harder than they used to be. So one thing that we do find by research, and one thing that you can take away from today, is the number one risk factor to have Alzheimer's. So what is the population that is at the highest risk? And that is for any of our individuals, male, female, doesn't matter, brown, black, white, is if they are over the age of 65. That is the number one risk factor. So 65 and above are at significantly higher risk for an Alzheimer's diagnosis specifically. So just knowing that sometimes we are having these conversations. My dad obviously was older than me. I'm not too worried about it. Aging is going to happen to you someday, kid. That definitely was part of the conversation. He was a very lighthearted person. So if I say some of these things and you're like, ouch, that kind of hurts. He meant it in love, of course, but it is definitely something as our sandwich generation. I'm a mom, how do we navigate that as trying to help one of our elders or someone that is really important to us can be very sticky sometimes. So, conversations in general. So, a lot of the examples that I'm going to share with you today are in regards to driving because that's typically the questions that I get and some of the stickiest conversations to have. But hopefully, these are things that you can take away, take some notes on. Know that our website has all of this information. If you can't keep up with me, I kind of talk a little bit fast sometimes on any of these conversations that can get sticky. So sooner is better than later, and ideally not waiting until that fall. Falls are when I typically get a call. They're in the hospital. We haven't talked about these things yet. What should I do? Any of those crisis moments that we want to make sure that we have a plan ahead of time, whether or not it's financial, for driving, for, a doctor's appointment or a medical need. Sooner rather than later is always going to be best. Develop a plan for using finesse. So, who is going to be in the conversation? Why are they going to be in the conversation? And what is the comprehension of the person with memory issues on who they are and how they fit, right? So, it's not just about the words that we're going to use, but how are we setting up this conversation, especially if it's a bigger one, like taking away keys or something like that. Because if we have someone there that they don't know or that they think is a different person, then that's not going to be helpful for us in this conversation. So we want to make sure that we think about the who, the when, the where, and the why. Taking notes about the changes that you see. That's the number one tip that I give to families, caregivers, daughters, you name it, is just making sure that pen and paper is the biggest benefit to you because what you will want to do in that diary is, as a caregiver, what are the things that you're seeing, is write down what you saw, the date, and the time of when you see these differences. This will be really helpful for your clinical team. My mom would actually write all of her, but she would rewrite her notes afterwards of the time, the date, everything into a letter. She has secretary background. That was just the way that her mind worked. And she would actually send in those notes via snail mail. She didn't trust my chart at the time. And so she would send that in snail mail the week before his doctor's appointment. So it gave the clinical team time to look over date, time, and what was going on. Why is date and time important? Because date is going to tell you frequency. How many times is this same behavior happening? And then time is going to help them know if it is something that's happening more in a sundowning time frame or if it's something that maybe was, happening all times of day. Sundowning is not a diagnosis. It's not exactly, say, a symptom. Sundowning is kind of a terminology that's used in the memory world in regards to when people get most rambunctious, a little more anxious, typically in the afternoon or early evening hours, so when the sun is going down. At the memory care, that's when we would do the most of our outings, is because a lot of times people feel like they need to be doing something, whether or not it's picking up kids from school, getting off of work, figuring out what we're doing for dinner. And so that anxious feeling, we didn't fight it as much as possible. We tried to get into the van and go for a country drive or whatever the case may be. But if these behaviors or these things that you are seeing are happening during that time, that can be helpful for the diagnosis process. Um, these types of things I'm talking about are more for medical reasons, but this can be helpful if you have notes in regards to conversations that you had for legal or financial conversations too. And then within driving, that can be helpful too for if it ends up being a legal matter or if it ends up being more of a clinical matter that we have to have a driving evaluation or something, it can be used for different conversations too. So, taking notes, practice in advance. Sometimes you have the luxury of time, sometimes you don't. So, with my dad, it was a slow progression that we had to basically figure out everything that it wasn't before we got the dementia diagnosis of what it was with how young he was. It didn't run in his family. It was just very, very odd. And to this day, we have no cause as to why he got the type of disease that he did. We could practice some things we couldn't. But if you do have time on your side, practicing in front of a mirror or with someone that understands can be helpful, especially if family dynamics are sticky. Talk when you are both relaxed and comfortable, right? Ideally, if we do this sooner rather than later, then we can hopefully be in a more relaxed situation. For my dad, one of the hardest conversations that we ever had was at a Wendy's in Council Bluffs, Iowa, because he loved food. He wanted to be a part of it, and he'd rather eat and not make eye contact while we had some really important situations. So, a relaxed area might not be a Wendy's for everybody, but for knowing my dad, knowing that we needed to have family come in from out of town to have this conversation, it was just what worked best for us. So this might be in someone's living room. It might be in their kind of digs. Where do they feel most comfortable at? Or it might just be on a phone call in a car. It just kind of depends on the situation. So, conversations about going to the doctor. A lot of people are fearful of, well, what if they write down that I have dementia? Like, there's a lot of weight to that. So, sometimes just getting them to the doctor is going to be the biggest feat. And so, understanding that there's fear of the unknown, there might be anger. Maybe they, are getting forgetful and they feel like they're going to the doctor all of the time. Confusion with time and place is very, very common with most types of dementia. And so that anger of, why do I have to go to the doctor again? I don't need help is definitely something that we see with most types. The stigma of having a dementia diagnosis, if they go to the doctor, then they have no control over what they write down and what they see. And so that stigma of what's going to happen if, people see this, they know I have a diagnosis, I'm getting help. I think it's gotten better over time and awareness and knowing that it is the disease, not them. But it's still definitely out there. And I'd be lying if I said that my mom didn't say, don't say anything to your friends, to your clinicians, to all the people that would understand, because we just don't know what this means for us yet. I couldn't tell my dad's story for probably the first year of the situation because we just didn't know why he was getting this. If it was something that maybe he did and he didn't know why it came to him, we just didn't know that why. And so that hesitation, that stigma. My extended family is from rural Iowa. And so, that was her upbringing as well, was hold it, don't talk about it, it's going to be okay. And once we realized it was not his fault, there was no reason to hold it, that was really, really helpful for us to seek help and be able to know that we weren't alone. For the clinician, the diagnosis, like I talked about, once they write down dementia, they really can't take it off. For checkups, just know that in the state of Iowa, we rank as one of the lowest in the United States for having our primary care clinicians bill for something called a Medicare annual visit memory test. Okay, just layman's terms, right? Told you I'm not a physician. So, especially in our rural areas. So, what I was wanting was to have a memory test. It's called a mini cognitive assessment. It's something that a primary care physician can do. They can also do different types of it with home health. So, if you have a home health nurse coming in and out, sometimes they can do it as well. But it's usually about 27, 28 questions. By the end of his diagnostic doctor's appointments, he actually, with his type of dementia, he remembered the questions, he memorized them. He was so sneaky smart, he was so intelligent. And so they're not rocket science, crazy questions, but some of you may have done them. So a lot of times they're drawing the clock. They're saying, do you know what season it is? Do you know where you're at? Orientation to time and place. And so what we are seeing is that maybe our clinicians are doing that as part of a Medicare annual visit, which they can bill for, they can get reimbursement for, but we're not seeing notation of that. So what we are encouraging, and we have a doctor on our board, his name's Dr. Yogi Shah. He's with Broadlawns Medical Center, and he is who shared the statistics with us from University of Iowa, where we do all of our research really through, that's granted and funded by the association, is that we need to get the word out there, that especially our rural Iowans need to be asking, can you make sure that you are doing a mini cognitive assessment with my Medicare annual? A Medicare annual is typically for people that are over 65, but there are certain situations, like my dad, where he qualified for Medicare early. So, depending on disability status and things like that, this is not just for 65 and above, but it can be a benefit that people can ask about. If a physician says, I'm not ready to do the mini cognitive assessment, I'm not sure about it, just know that it is something within your control as a caregiver or a family member that can be helpful at checkups. And then you can see it over time. Say that they score really, really well, that they didn't need it. You could do it the next year and compare those points over time to see if there's any changes. Because in that 15 minutes that you get with the doctor, they can't always test that, but by seeing your notes, knowing the questions to ask and where to compare to can be really helpful. And seeking medical help. Like I said, getting that diagnosis was really helpful so that we could get hospice and home health services for my dad, even though he was very young. So we're going to hear Donna on the importance of getting help. Audio is always something that I'm never perfect at, so I'm going to turn it up here about 3/4 of the way. And if I see some thumbs down that I need to turn it down, you just let me know, okay?
I think you have to be honest.
Turning it up.
I think that's the important thing with it. To get a loved one to the doctor. I think you just need to be candid and honest of what are you trying to do. We're trying to understand what we're up against. It's just so important to do that because you can't battle something that you don't know what you're battling. Again, it may not have been Alzheimer's, it could have been depression, it could have been so many other things. And guess what? There's other things you can do to take care of those issues as well. But that's what you need to be able to do. You can't ignore something, it's not going to go away.
I think it's really helpful to hear that because a lot of the same symptoms and warning signs can look similar between the three Ds. So there's dementia, depression, and delirium. All three of them have very, very similar first signs and symptoms. And so, especially if the person's in a crisis mode, they're in the hospital, they just fell, we need to really figure out if this is kind of that hospital fogginess, if it's depression. My dad had depression and dementia because the medicines are going to work differently. Depression is a chemical imbalance of the brain. Dementia is a physical imbalance of the brain. His brain was shrinking with depression. There's chemical imbalances that are different. So we just want to make sure that we're talking about everything that it could not be as we are looking through the dementia diagnosis process too. So, when we are wanting those tips to help with the conversation of getting to the doctor, right? That big win, we want to use words that are most comfortable for the person. So, with my dad, we knew that as we progressed and went to higher levels of doctors, that he was going to do more and more testing. And so, it was more comfortable for us to say, "Hey, Dad, we're trying to get you more help. Can you please make sure that when we get here, don't shy away from telling them what's going on." And for him, that meant writing down what was going on. With frontotemporal dementia, he was completely nonverbal, pretty much within the first 2 years of his 5-year journey. And so, what was most comfortable for him and his way to share what was happening with him was via notepads. So we always had notepads everywhere to make sure that he had that comfort as well and could use the words that made sense to him because his brain would kind of jumble up words that were kind of similar, you know? And so just making sure that we were using words that made sense to him. Suggest the Medicare free annual wellness visit I was kind of telling you about. So, like I said, this is not anything in addition that the physician, the NP, doesn't get billed for. They can bill for it. It still is good for them. They can still make time outside of obviously building that relationship with their patients and their families, but it is something that you can advocate for and make sure has already been done for your loved one. Parent enjoyable outing with the doctor's visit. We always got ice cream afterwards. Dad was a sucker for ice cream, and so we did that with a lot of our all my friends that I got to take care of at the memory care as well. So, sometimes it was a Sonic slushie or whatever the case may be, but just making sure that we realize that this is a big thing to them to even show up and let us get them more help. And we wanted to make sure that we said thank you and that it was seen. Invite family to communicate concerns and questions to the doctor. So, obviously, post-COVID, they got a little bit more stringent on how many people are we going to have in this room, right? But with my dad's big appointment that we had where we got the diagnosis, my mom initially was like, I don't want to bother you with it. I've got all my notes. I can take the notes. I can do this. I have that background. And I said, Mom, you are going to be listening for him and translating for him. I want to be the note taker for you so that you can remember things that maybe happen that you're going to blank out on. And it's totally normal. It's going to happen. And so, really, just reiterating that if you have that trusted individual that can be the note taker during these, obviously, we've gotten to a better place where a lot of those notes are going to be taken in our, my charts, electronic charts. But sometimes those things that are really important that we miss might not be in a full note in there. And so having someone that can notate that can be very helpful. If still reluctant, try using a therapeutic fib. So, we use the word therapeutic fib. Some people will say, well, it's a white lie or it's something that is untrue. Within a dementia situation, we want to make sure that we are getting them what can make them comfortable down the road. And so, with my dad, getting him to the doctor really was never an issue, but with some of my other patients, it was. And so, just reiterating that we're going out to lunch. We're going out for ice cream. What they may not know is that we're going to the doctor first, but we would need to make sure that we're all showered, we're all dressed, we're ready to go. And so, with a therapeutic fib like that, it might not be the full truth, but it's something that they can look forward to so that we can get them out of the house, less stress on them, over the time, and it's not perfect for every family. Every family is not in favor of doing therapeutic fibs, and that's okay. For us, it was more helpful for my dad if he was going to have any pushback, which wasn't the doctor, but maybe some other things that we had to make hard decisions on, to make sure that he knew that we were doing it in his best interest, and that he trusted us through that we would make the ultimate right decision and not cause him anxiety before that situation. So the big question is when? When do we have that conversation? Why do we have that conversation? I'm going to share a book with you. So if you are a book reader, one of the books that was really, really helpful for me, it is an audio book as well. So I am not a reader. Fall asleep. I can't do paperback, but I could do the audio, and it's called Where the Light Gets In, and it's by Kimberly Williams Paisley. If you've ever seen Father of the Bride, it's The Bride with Steve Martin. Kimberly is the brunette in that movie, and she is the wife of Brad Paisley. So if you're a country fan, that's Mrs. Paisley right there. And so Where the Light Gets In by Kimberly Williams Paisley is the story of how she had a similar journey to what my dad had, her mom had. And so she had a really, really hard conversation with her siblings, being a caregiver from afar, with her dad on how to have this driving conversation, because her mom was very, very stringent on that independence of getting those keys taken away, especially at a younger age, and really not being able to get the words out that she wanted to, and how that frustration affected her. So if you are a book person, you want to read it. I like the book because it is lighthearted for a tough topic, and she brings some comedy and some lightheartedness into it, so it's not so hard to listen to or read. But have you noticed any accidents? Her mom had an accident in the Costco parking lot, if I remember correctly, and she didn't tell anybody. But the next time that they went to Costco as a family, the store director saw them, and they're like, "Hey, Linda, you doing okay? What can I do to help you?" It ruined a retaining wall. They kind of saw some of the dents in the car, obviously, and knew something had happened. But that she kind of walks through how they had to have that conversation and do a little bit of research since she couldn't say what happened. Traffic tickets. That's the first thing that happened with my dad. So in Council Bluffs, we have something called red light cameras. And so when I was in the hospital having my oldest son, he was in the car and he ran a red light. And we got the picture in the mail. It was in my mom's car, so she got it. Thank goodness. If it had come to him, he might have thrown it away or something like that. And we were able to say, "Hey, why didn't you tell us about this?" And he didn't remember. So it was one of those things that those traffic tickets can unfortunately be a tell sign, but it was helpful for us to get a diagnosis for him too, because he couldn't remember. Scrapes on the car, like I said, that definitely is something that you might see and want to keep an eye out for, as well as mistakes while driving. So with my dad, not only did he get the traffic ticket, but he was driving down the same road to my house and he was speeding. And I mean, he had a lead foot, don't get me wrong, loved him to death, but he was really speeding. And he knew that he was leaving my house as I had my newborn in the car. We were crossing paths. And so I knew that he didn't realize how fast he was going. And that's a common thing within multiple types of dementia, is that depth perception is off. And so their peripheral vision is usually impaired. So he might have not seen the speed limit sign. He might have not seen that there was a stop sign coming up because of the depth perception. But just knowing that that's not them being malicious or silly with judgment all the time. Sometimes it is a physical thing that's happening within their brain with the shrinkage, or things that are happening in the occipital lobe that's out of their control. So speeding and not seeing signs can definitely be a risk. You'll see a common thread throughout here. There's a lot of dads having these conversations. So even though women are at higher risk for having a dementia diagnosis, some of these harder conversations for the video purposes, for my purposes, end up being with dads. So hopefully Chris's story is helpful for you as well.
There's no exact answer on this is when you stop driving. You could tell when coming up to an intersection, as an example, the ability to understand what's going on around you was starting to deteriorate a little bit. Being on the highway with cars on both sides becomes a little bit more difficult. And first and foremost, the safety of everybody in the car as well as other drivers on the road. You think about that, and you want to make sure you're not putting anybody in danger. But then the difficult part is telling your dad, who you love, and you know he loves driving, and he's used to it, that he can no longer do that. But then even then, taking the keys away full time was very difficult. The doctor was very helpful and just saying, medically, you can't do this anymore. But my mother had the hardest time with this because she knew how much this was going to hurt him as well. And this is one of the first things that we had to deal with as a family when it came to telling my dad that he had to stop doing something because of this disease. That meant a lot to him.
And I will say that with my dad, he gave us the keys. He handed them to us willingly, and that does not happen very often. So I will say that if there is any luck in this whole situation, we were very lucky that he was very understanding. And I think that it had a lot to do with kind of where we were at. He had his first grandchild. He realized that he could help or potentially hurt someone with this, and it wasn't malicious or anything. But I think that that's what sank in and made it a simpler handoff for us. Also, he was thinking financially too, so it made sense he wasn't working at that time. It was additional money to have two cars. It made more sense for my mom if they sold the second car for income purposes and things like that. So, my dad wasn't always a numbers person, but for multiple reasons, it made sense. And he said, you know what? It doesn't make sense for me to be driving anymore. I will say, though, that it's not that way for everyone. But what we want to do is when we are having the conversation of stopping driving, we want to plan ahead before an accident occurs, right? We're very lucky that when he went through that red light, that he didn't hurt anybody. And so we really want to make sure that we're having this before an accident happens, but that doesn't always happen. So make sure that you read the book if it has been happening. Express your concern about specific changes you noticed. Like I said, I was worried about his speeding because of having children in the car. And I think that that was really, really impactful for him. Appeal to the person's sense of responsibility and concern for others, yet again. And Sheila will talk about what it was like when she talked about it with her dad. I will say if these videos aren't really kind of connecting to someone that you're thinking about with this, we do have a whole page dedicated to this topic on alz.org, and it's /driving. And so they have 4 videos of 4 different situations. If they haven't updated it, which they're great about updating. And some of them are not easy conversations. There is some pushback from some of the people that have dementia and saying, no, I'm not going to give you those keys. So I appreciate that about those videos because hopefully it can help families that didn't have the same situation that we did.
Some tips on having the conversation is pointing out, especially for my father, the potential danger to others that it may cause if he's behind the wheel. And just talking about it from the standpoint that this is not only the best thing for you, but this is also the best thing for others around you. And these are some of the alternatives, making sure that this is what's going to happen, having a plan. If mom can't take you, then Uncle Thomas or will be here to take you, and we will make sure that you're getting out of the house and that you're doing some things. So, presenting the bad news, but then also presenting the plan. And for my father, that's really, really important to have a plan.
And I will take this opportunity to share, I told you that women are at significantly higher risk, not only of having an Alzheimer's diagnosis, but also being a caregiver. So 2/3 of caregivers are women, 1/3 of caregivers are daughters. So you'll see, obviously, Sheila is a daughter in this situation. We also know that there are populations that are at significantly higher risk. Our Black community is 2 times more likely to have a dementia diagnosis, specifically Alzheimer's, as well as our Hispanic community. They're 1.5 times more likely. So as Sheila, she's a woman, she's Black. Those things are things that she's thinking about too for her down the road, and knowing that she has a parent or a sibling, if you have a sibling, that increases your risk as well. Just because my great-grandfather on my mom's side had Alzheimer's does not mean that I'm going to have it, but it significantly heightens my risk, even though we know my dad's was not genetic, that I potentially could have it too. So, parent or sibling puts you at significantly higher risk, as well as some of those other demographics. So offer alternative plans for transportation. With my dad, we would come and pick him up, and that's not always an opportunity for people. And so sometimes when people realize that they can't have the keys anymore, that's when they have more conversations on whether or not it's safe to be at home if they need to have that flexibility with transportation. So the memory care that I worked at had transportation included in the cost of living for the community. It was a private pay community. It was not applicable for everyone, but there is transportation that is available at most assisted livings or independent living communities. More assisted living versus independent, but just know that that is an option. And then within the city, we have a transportation that is available. We can call City Hall and they'll give you more information, at least in Council Bluffs. And that ticket is $2.50 each way. And they do have wheelchair options for short buses versus a, more city-like bus that you kind of think about when you talk about city transportation. So know that those might be things that the AAAs have, the area agencies on aging typically have resources for that. So make sure to reach out if you do have questions in regards to transportation. Incorporate the voice of an esteemed professional and have empathy. Easier said than done. A lot of my patients at the memory care had that understanding of authority was really important to them. So a doctor saying that you shouldn't be driving was much more beneficial and stuck with someone than saying the wife or the loved one or the spouse saying that it's not safe to be driving, Dad. I will say that there are not all clinicians that are ready to write that down on a piece of paper or be that bad guy, if you want to call it that. But it really can be helpful for any legal conversations that you have too, because the clinical verbiage and the legal verbiage may not be the same if something were to ever come up in court. So you really want to make sure that whoever that esteemed professional is, that they are on the same page and being able to give you that wording if you know that possibly there could be legal complications.
Talking to somebody about stopping driving, I think it's most important to understand that that is tied to someone's independence more than most things. And so by saying you can't do this anymore is like telling the person, it's like ripping away their independence. And that doesn't feel good for anybody. I know that I've always tried to put myself in that situation. What would I think if someone was saying this to me? You don't get to do this anymore. And how would I feel? And how would I want somebody to talk to me about this? And so if you try to I think sometimes too many people try to approach it as, very punitive. And I'm doing what's right for you. So why don't you understand, without really turning the tables and putting themselves in that position, understanding, how helpless that feels to take those things away. It's important to be thoughtful about what that experience is like for the individual.
All right, when to stop driving, we want to make sure that we maximize independence. So giving them options. My grandmother-in-law does not have dementia, but she has glaucoma. And so we've had this conversation recently. It's not safe for her to drive. She's okay with giving the keys, but she will say, even though she willingly sold her car herself, those options of transportation have hit her a lot harder than she expected it to. So just knowing that if we have options within the community, she can get transportation at the community that she moved to, and choices and being able to be a part of the planning. So typically when I do come to pick her up for an appointment, I'll ask her, hey, do you need to run to Dollar Tree? Hey, do you need to run here, there, or the other place, to make sure that she thinks about those places that she might feel burdensome or bothersome by asking, hey, can we go one more place? I ask her first. Legal and financial planning, obviously, too, if I have time for it. If it's not something that I can't offer or follow through on, then obviously not bringing it up or saying, hey, this time I don't have enough time for it, but can we set up another time? Legal and financial planning. So, like I said, clinical verbiage and legal verbiage are not always the same and they don't always go up in court. So just making sure that you're working with a trusted individual. When you are working with dementia, you don't always have to go with a specific elder care attorney. Okay. So sometimes people are like, well, I want to have someone that specializes in this. You can go to the Iowa State Bar Association's website. You can find information on all of the attorneys that are within their Iowa Bar Association information and make sure that you look at all of your options because maybe you need to know if selling the car is going to have any implications for a Medicaid spend down. Maybe you need to know more information if, there's a lot of finances and things like that. So the Iowa State Bar Association can be a really great resource as well as information from the area agencies on aging too in your area.
Financially, this disease will increase the cost of living. It's just a fact. So planning for those extra costs is that much more important than what you were planning for before. And so you have to review everything that's in place, see what changes needed to be made, both legally and financially, and you have to monitor that going forward afterwards too.
We could have a whole conversation on Medicaid spend down, but that's not what we're doing here today. Just know that that makes it a lot more complicated. But if that is a necessity, make sure that you reach out to Madeline and the team because they might be able to help you with some navigation for that piece. So conversations about legal and financial planning. So a lot of times the person that might be seeing these symptoms may be reluctant, uncomfortable, feeling like it's intrusive on their own private information and felt like it's disrespectful. How dare you? I can do my own stuff. And so making sure that we're thinking about those things we talked about first. Where are we going to have the conversation? Who's going to be there? How are we going to use the words is really important. So the next video is my favorite by far of all of them. I will say that her body language on how to have this conversation is not always my favorite, but I think that her words are more important than her body language. So listen in to Julie and see what you think.
Here's what I've come to after all of this. That it's the most loving and kind thing you can do for them is to be honest with them and say, this is like a really scary thing. And I feel a lot of discomfort bringing this up to you, but I tell them, if you're going to be the one who's going to take them on this journey, then you have to tell them, I'm going to be here on this journey with you. And there are things that we have to do to get this in place. We're going to go on this journey together. I've told you I'm going to be here with you till the end. So let's get this ready. It's like we're going to go on an ocean ship. We've got to get things packed up. We've got to figure out what we're taking with us. We got to get ready. And the things that we have to get ready, we have to make sure that we know which doctors you're going to be using. I need to get this signed, okay? So that if you go in there and they have to do surgery, for example, I got to have this durable power of attorney for health care for you. I have to have this worked out, okay? Now, if for some reason, okay, you need to go to rehab after something, I have to have these documents here, the financial stuff, so I can get these things taken care of for you while this is going on. I don't want to have anything get in the way of us being able to progress and keep doing this. I said, it seems hard because it's hard in our heads. Everybody's read about people who've stolen from elderly people, who've done these horrible things. But if you're the person who's approaching this with loving kindness and compassion, and you're willing to take this person on this journey, you're not doing a bad thing. You're doing the right thing by talking to them about it. And you approach it from the standpoint of, I'm here for you. I'm doing this for you. We're going to do this together. And I'm going to help you through this. And these are the tools that I need to make sure that we can do this.
I love Julie. I want to give her an amen. But I also want to tell her that if she was talking to my dad like that and her shoulders and her face kept getting closer and closer to him, he would probably do the same thing and mirror it back to her and then it gets elevated. So the big thing that I would say is that, yes, I like her wording. I like where she's coming from with the empathy, but making sure that we put our shoulders back, take a deep breath. This is going to be a hard conversation, but elevating and getting closer and closer to them is not always going to be the best way, just thinking about those nonverbals too. So begin by explaining that you are in it together. I'm going to click through these pretty quickly because I feel like she went over it better than maybe the slides say. Start by asking questions and gathering documents. If the AAAs don't have it, we do, but there's a document called the Five Wishes. Five Wishes is a document that goes over some of the questions that maybe a durable power of attorney doesn't. There are ways that you can get it for free online, but if you ever want it notarized or you want to get the actual document from the company that made it, there might be a $20 fee or so. But the attorney that we went through, she actually puts that in every opening packet that she has with dementia families. She's like, these are going to be questions that I don't go over, and they're important for you guys to know about. So if you're looking for a document to kind of go over what some of those questions might be, it doesn't always ask just about legal or financial questions. It might ask, do you have your do not resuscitate in in a place that I can find it? Do you want a feeding tube someday? Do you want truly nothing by mouth? That means popsicles. That means nothing, if we get to that point. So it just asks a little bit more in-depth questions that you might not think of in the heat of the moment. Explain that these are standard plans that need to be made as we get older. I literally was on the phone with a family friend that is figuring out if her mom should go to rehab or not, and then had a unexpected passing away in their sleep last night. So all these things happen in real life, and so just making sure that we're prepared for those things, unfortunately. Break the conversation into parts and try different times and locations. When I was having this conversation with my mom, it was every morning on the way to drop the kids off at daycare. It was a phone call. It wasn't always in-depth conversations, but what did you see with Dad last night? Do you need any help? What can I help with? Involve others as needed. Sometimes that means uninvolving others as needed as well too. So the care team is not just the family. It can be the medical team, primary care, and specialists, right? Sometimes we have to have a specialist and neurologist involved. Peers, trusted peers, people from church, people that see them on a regular basis, know what they used to be like to see those changes, sometimes to have that conversation with the spouse of, Steve is wandering and he wouldn't have done that without you in the past. Those types of peers are really going to be helpful for these conversations. Workplace. That was one of the biggest things my mom kept leaning on, that his workplace was going to say something about it. Well, there are legalities that get into that when you're under the age of 62 and ADA compliance and things like that. So workplace can be really helpful. Sometimes they just have regulations in place that they might not be able to help if they are young enough to be in the workplace still. And then community resources. So, I know I've said the AAAs a million times, but they are a huge resource. And so they're going to be able to say, even though I'm in Council Bluffs, I have resources with the association. I may not know who a ship counselor is in your area that can go over your insurance stuff. They probably would. And so just making sure that you know that the local information can be seen at the 6 area agencies across the state, as well as if they need anything, that they reach out to us if there's anything we can help out with too. So I'm not going away. You guys can call me. They can talk to me. You can reach out. You can talk to someone else if I annoy you, whatever the case may be. But we've got lots of resources. So we are implementing a navigator plan on our website. So say Madeline calls me and says, Jessica, I just got a diagnosis. I've got mild cognitive impairment. What can I do? We are implementing a way that someone can do a care plan online with their loved one before they feel comfortable going into a doctor's appointment again. Or maybe they didn't like the doctor, whatever the case may be. It's never going to take place of that doctor, but giving you a little bit more of a plan of, okay, have we thought about this, this, and this? So to come, but know that that is coming. Our community resource finder is where I put all of my information in. So say you're listening today and you're like, man, I'd really like to go to a support group that other people get this. We do have support groups that are by trained individuals that have to go through a background check with the association. We have over 50 across the state. We have at least 2 that are virtual. We're working on 4 more. So for our rural communities, know that that can be something if it's not within the mileage rating that you want. And so you can find that at alz.org/CRF. Make sure you put that in the chat box if you have any questions, and I will put that link here in the chat box too if you want to kind of look through it while I'm talking here. It also has our free community education. So if you would have logged into it before today, you would have seen that I was going to be talking today. So we do have those. We have at least 10 different topics we can do for different groups, libraries, churches, conferences, you name it, clinicians, we've got it. So the 10 warning signs is one of my favorites. It might be a next step from this conversation too. There we do have a free Alls Connected, which is kind of a platform, kind of like a Facebook for dementia families that you don't have to worry about as much spam or people putting different things on. Alls Connected can be a really great resource as well as that helpline. So 800-272-3900 is the one thing that I want you to make sure that if you take out your phone now and zone me out for 30 seconds, that's fine. I'd rather you put it in your phone and have it and not need it. But like I said, it's available 24/7. These are also crisis trained master level clinicians. So say you have a depressed caregiver that calls in the middle of the night, they can help with de-escalation. They'll never take the place of 911, but they are ready for some of those harder conversations. And they are able to have, their average call length is 1 hour and 45 minutes. So these are not people that are going to be like, hey, heard you, not going to talk to you. They will be able to do that. There's a million other resources on here, but I want to make sure that we do have some time at the end for anything. Know that you're not alone. Talk about it. Make sure that you do. We think it's that important that we'll put it up on the screen again. So thank you again for having me. Ready for any questions, and reach out if you are listening to the recording and thought of something that I didn't go over. Thank you.
Thank you so much. We'll wait a few minutes and see if any questions come in. I really appreciate you speaking with us today. I find it really helpful that you share your personal story, and that makes it a little bit less scary to have these conversations if you're able to kind of understand it from somebody who's gone through it firsthand. So I really appreciate you coming today.
No problem. I did forget 2 hacks, so I'm going to give you 2 hacks. One hack is that if you have someone that you're worried about, they're driving and you don't know where they're going, a free resource that my dad had. We don't we don't really say, yes, use this product over this product or anything like that with the association, just personal experience. There is an app for smartphones called Life 360. It is free. There are paid subscriptions. You can have the fancy ones. We just did the free one. And then that way we could see where my dad was going when he was driving, and it would notify us when he would leave the house and things like that. So know that Life 360 is a free app. There is a free version of it. And then the other thing that was helpful was that we put something called a tile on his car keys. And so the tile helped us when he lost his keys and he accidentally was taking the garbage out and the keys fell in the garbage can. Had we not thought to look for that, it was a $500 fob for the key to replace it. And so a tile can be a great gift for someone if you're thinking
Awesome.
about it and they've had a hard time.
Thank you.
No problem.
Could you say the phone number for the online? I'm on the phone, so I can't see what you wrote.
Yeah, no problem. So the 24/7 care team line is 800-272-3900. Like I said, those are my coworkers, so you're not going to talk to a robot when you call that number.
Okay. Thank you very much.
No problem. I do see we had 24 to 30 people on here. Please make sure to put your first, last name, and zip code in here. If you're on the phone, if you don't mind saying your first, last name, and zip code, this keeps it so that we can do these for free across the state. And then that way we can make sure that we're reaching all of the counties in the area. So if you don't mind putting that in the chat, it really does help us be able to keep helping people.
So mine is Barbara Scheller 52245.
52245.
Yep.
Correct.
Awesome. Thank you so much, Barbara.
Thank you. It was very helpful.
Problem. All right. Well, I'm going to stay on and write down this information, Madeline. If you need anything from me, just let me know. But
Okay. Thank you. Have a good day, everybody.
Yep. Take care. Bye-bye.